ये क्यों नहीं हो रहा?
Good evening, everyone present here. I am Faraz from IGCP Group. Welcome all the participants on today's webinar. Let's welcome today's speaker with great honor, none other than Dr. Pawan Gupta sir. And let me share some of the achievement of sir. Sir is Director HNN at Max Super Specialty Hospital, Vaishali, Patarparganj, Delhi. He is a founder of I Can Care. And today sir is going to speak on a very important topic, that is unmasking the beast, a rare case of Carcinosarcoma in oral cavity. So to know about details in this topic, I would like to invite sir and hand over this session to sir. Sir, over to you, sir. You can proceed from here.
Yeah. Thank you so much, and I'm really glad for being present here. This is John. Normally, when we are talking about oral cancers, we are the common cancers that we get is the squamous cell carcinoma. It is a very ulcerated lesion. One can really make it out once we just have a look at it. But sometimes there are certain rare tumors like salivary gland tumors, or there can be melanoma, there can be lymphomas. And then this is a one very atypical tumor, what we call it as carcinosarcoma. So today what I'm going to do is I'm just going to present you a very atypical case of a lesion in the oral cavity, and how to come to the diagnosis and what are the issues that we can face, right? So I'm going to talk to you about a lady. She is a 73-year-old Santosh Malhotra by the name, and a female lady, a homemaker. And she presented, just look at this lesion, which is in the molar area, right, in the right side lower jaw. You can see that it is a quite a pedunculated large mass sort of lesion. It is not ulcerated. It is a fleshy lesion, and it has been present for just 1 month. She had come to me with this large lesion. She had been biopsied outside by a dental surgeon who had given it as a epulis and a non-malignant sort of a lesion. The look was that it was a fleshy lesion, but the biopsy being negative, what we planned, and she had no history that there was no trismus, there was no skin involvement, no change in voice, no numbness of over face, no change in taste sensation, no loss of weight or appetite. So these are some, very atypical. Like most of the squamous cell carcinoma, which is the commonest tumor in the oral cavity, you will have some of the other lesions, so other symptoms. She was non-diabetic. She had no other medical comorbidities. She was a very pious lady, a religious lady, doing every day doing yoga, and was quite fit. And no history of alcohol or tobacco. This is another very important aspect, because a lesion on the alveolus, right, and a pedunculate or a mass-like lesion on the alveolus. Generally, we talk it that it is an epulis sort of a thing, right? So we just looking at this a vital. She was quite lean built and elderly lady, and local examination, of course, the mouth opening was quite good. 3 fingers mouth good. Oral hygiene was not very bad, although it is written poor. But she was a means means well nourished lady, and had a good hygiene all over, right? And what we noticed was this was a 4 into 4 centimeter proliferative round circular pedunculated mass in the right posterior mandibular, with loose and lingually displaced last present molar teeth. So this was like, it's something which is sitting on the alveolus, right? Right there, sitting on the alveolus, pushing the teeth. We did an OPG, and there was no, means no definite signs that would suggest that it was infiltrative sort of lesion. And just you can see this lesion which is there, and it was the mass was pushing the buccal mucosa, pushing the tongue, and displacing the teeth, and it was just coming close to the rectomolar triangle, right? The neck nodes were negative. So we got this biopsy reviewed, and the review of the biopsy also showed that it was a fibrous epulis like lesion, right? The MRA was a well-defined heterogeneously enhancing T2 hyperintense and T1 hyperintense mass lesion arising from right lower gingivobuccal sulcus. Ill-defined areas of altered marrow signal intensity showing steer hyperintense with post-contrast. So overall, it was not showing any major thing. So just in a summary, a 73-year-old lady with a 4 into 4 centimeter proliferative circular mass on the sitting just on the alveolus. And so any lesion, any mass on the alveolus, generally we put it as a epulis. The generalized term is epulis. So this epulis can be of various varieties. It can be tubercular epulis, it can be infective, it can be uh, carcinomas, it can be a malignant epulis, right? So here what we did was, because the biopsies was negative, the invasive component was missing, so we thought to be a diagnosis of fibrous epulis. And what we did was, we did a large local excision of the lesion with the primary closure was done. Just look at the lesion, we had just removed it, we sent it for a good closure, a good outcome was there to the patients, right? So this is just the lesion, how it has been taken out, completely well-defined area that has been taken out, and it has been subjected for a final biopsy report. Now this was when we sent it for the final biopsy report, this came out to be a excised specimen, revealed the lesion to be a tumor with spindle cell morphology. The immunochemistry was done. The panel revealed tumor cells positive for P40, P63, SMA, and negative for S100 and desmin. So it was more like a spindle cell squamous cell carcinoma. That is what we put it as, a carcinosarcoma. Generally, a carcinosarcoma arises in a patient who has undergone radiotherapy. We see this in cases of breast, we see this in cases of oral cavity, like we have seen in certain cases of tongue. But in this patient who had no symptoms, no radiation, nothing which was there, it was just a simple growth on the alveolus, non tobacco users, non alcoholic, everything in the oral cavity was clean. So this was something that was really, we were quite surprised. And we then we did a further investigations on this patient. And we did a good MRI, we did a PET scan. And the patient actually disappeared. Patient was not ready to believe that she had a carcinosarcoma, and then she went out for second opinions and third opinions. And then at a major government hospital, she got the slides reviewed, who also gave that it is a malignant carcinosarcoma, or the malignant epulis, right? It was a carcinosarcoma. It was a fleshy tumor, pedunculated fleshy tumor, no ulceration. So it was like a something that we would put it as means spindle cell carcinoma with squamous cell present with us. So it is a carcinosarcoma of the oral cavity. So uh, this patient actually did not turn up for almost like 3 weeks, and then when she turned up, we did a further investigations, and that was the uh, whole body PET scan was done. We got that there was a 8.6, but again that there was a lesion which was growing there. And means there was lymph nodes which was non-specific. Generally carcinosarcomas do not give lymph nodes. And the whole tumor was there which was present at the area. One very surprising thing that came up was that at the costal pleura, there was one single lesion, or what we call the FDG. There was soft FDG uptake in the thorax. Carcinosarcomas have got a propensity to metastasize, and metastasis is commonly in the lungs. So now this was a dilemma, whether this patient has got a metastasis or whether it is a just a simple lesion, which is means just a common nodular lesion which can be present in the lungs. So being a carcinosarcoma, but the lesion being small, just a not much spread in the lesion, and without any nodal metastasis directly, a lymph node or a metastasis to the lung may be a rare thing to happen. We had our intervention radiologist to look at it. We had a generalized examination of this patient. We did have a second opinion. This lesion, which was looking like a suspicious lesion, suspicious of metastasis, uh, we thought we will go for a FNEC from that lesion. The FNEC was attempted, but it seems it was not possible to reach to that area. And so we examined what was there earlier and what was there at the present situation. There was no uptake on the X-ray, but a lesion only on the PET scan, which was very vague sort of lesion. So we thought that it would be rather we put it as a benign, and we went ahead with the surgical resection. So this patient was now taken up for surgery, and um, uh, uh, now this, because there was this lesion which was adherent or which was infiltrating into the mandible, we did a total or a segmental mandibulectomy, just leaving behind the condyle, and then we did a free fibula flap for this patient. So this was a complete. Now this patient is almost like uh, 6 weeks. Sorry, 3 weeks after surgery, we put her onto radiotherapy as well. Now she's undergoing radiotherapy, and we put her on a good mouth opening exercise with a Triscare instrument, so that the mouth opening is good, and a good diet has been given to her. Nutrition should be good maintained, so that she has a good outcome, and a radiation is now going on for this patient. So this is the entire patient that I had thought I would share with you. This is a very rare situation, rare case of carcinosarcoma, and so I think it's open for discussion. And in case you have any questions or any query, here you have, we can definitely discuss it on our my own Pawan GPT, or you can come through the. So thank you so much. I think that's the case, and it's a very rare case to happen. The commonest cases being normally we see uh, squamous cell carcinomas. This is a rare to get carcinosarcoma, that too completely in a naive patient who has not undergone any chemotherapy or radiotherapy, or so this is a rare thing to happen for these patients. A rare presentation of carcinosarcoma for these patients. So thank you so much, and I hand over to my host.
Thank you so much, sir, for taking out your important time and sharing your knowledge on this topic. I definitely think this session knowledge is going to help all the participants on their practice also. Sir, we have received some questions, sir. With all your permission, shall we take these questions one by one?
Of course, please.
Sir, I can see the first question is from Dr. Subramaniam. He is asking, sir, what are the current recommendation and adjuvant radiotherapy or chemotherapy in the oral car- carcinosarcoma, sir? Can you please elaborate on that?
Yeah, so see, basically, a carcinosarcoma has got both the components. That is, it has got a sarcomatous, that is a spindle cell component, as well as the squamous cell component. But any invasive sort of tumor, the staging of these tumors is similar to the squamous cell carcinomas. Like this lesion, which was invading into the bone, so it becomes a T4, and the nodal metastasis one are there to N0. So this is a basically a lesion which T4, that is the invasion of the mandible. So in such cases, we will definitely go for a, and this is a basically high grade tumors. These are a high propensity to spread. So radiotherapy is a must for such patients, and even in larger tumors, larger cases, we even go for a chemotherapy as a for these patients, because it has got both the components, and it has got high propensity to spread to the lungs, or to the, for metastasis to the lungs, to the liver, or to the bones. That is the commonest metastasis that we see in such cases.
Thank you so much, sir, for sharing your expertise on that question, sir. Moving forward, I can see another question, sir. How do you approach treatment decision in elder or medically unfit patient with his diagnosis, sir? Could you please share some point on that?
See, elderly patients, like this was a 72-year patient, but she was well, her ECOG was very good. Her quality means this, she was well maintained. We did a, definitely we went ahead and did her investigation, the cardiac as well as the respiratory, the pulmonary function test was done, and she was definitely fit, although she is more than 70, but she was fit for a surgical intervention. So as a carcinosarcoma, we have to do a wide excision, like any other lesions, like with a good margins we have to take. So we had a margin of almost like 2 centimeter on the bone part, and at least more than around 1.5 centimeter in the for the soft tissue part. And so we have to look at the fitness part, because these are all surgical tumors. We have to give a surgical. This will not subside with radiotherapy or chemotherapy, whether it is elderly or whether it is a, we have to go with the fitness for the patient, and then we have to decide that yes, we have to go for the surgery first, and then we go ahead with the chemotherapy and radiotherapy for these patients.
Thank you so much, sir, for answering the question, sir. I can't see any further questions from the participant. And one feedback from Dr. Subram. Thank you for responding and wonderful case study.
Thank you so
I
much.
hope we really enjoyed, sir. As there is no more questions, sir, with all your permission, shall we conclude this session for today?
Sure, sure. Thank you.
Thank you. And sir, we would like to see you in future also with different topics, sir. Till then, take care of yourself.
Definitely.
It was great honor to have you, sir.
Thank you so much.